Okay, let's unpack this. Today, we're taking a deep dive into something that causes immense stress for countless pets and the people who love them: noise phobias.
Yeah, sometimes called noise aversion. And it's incredibly common. Just think about how many pets react to fireworks or
Or
thunderstorms.
even just the vacuum cleaner.
Exactly. That level of fear, yeah, it's really distressing to see.
It really is. And our mission today, using the sources we've got, a clinical guide, some useful excerpts, is to, well, cut through the noise, you could say,
Yeah, nice.
and get to what really matters, like what is this phobia, how do you spot it, and maybe most importantly, what can you actually do to help your pet?
Right. We need to look at all those triggers, the obvious ones like fireworks, but also the everyday sounds they might face. Understanding the scope is definitely step one.
Okay, so let's start right there. What's the big difference between a pet just being startled by a loud noise, which seems pretty normal, right? And this really intense reaction, a true phobia?
That distinction is, yeah, absolutely critical. Fear. Fear is a natural survival thing. A brief reaction to something potentially dangerous, loud bang, you jump. Normal.
Okay.
A phobia, though, as the sources lay it out, it's an excessive fear.
Mm-hmm.
It's irrational, persistent,
Hmm.
totally out of proportion to any actual threat from the sound itself.
Ah, so it's not just the jump, it's the lasting panic, the fact they just can't shake it off.
Precisely. And there's a real physiological reason for this. Pets have, incredibly sharp hearing, way better than ours. Some sounds can be genuinely overwhelming for them, maybe even physically painful.
Mm.
So when that intense sound hits, it basically slams the gas on their sympathetic nervous system. It triggers that whole fight, flight, or freeze cascade.
I remember the sources mentioning this isn't just, barking or hiding, it affects their entire body.
Oh, absolutely. It's not just a little quirk. Their whole system is basically screaming danger.
Mm.
Behaviorally, yeah, you see avoidance, trying to escape. But inside,
What's happening inside?
their heart rate skyrockets. That's tachycardia. Stress hormones like cortisol flood their system. Their digestion can get upset. They might lose their appetite. They could even injure themselves trying to get away musculoskeletal trauma. Their nervous system is just firing on all cylinders. Breathing gets fast, shallow, tachypnea, even skin stuff like grooming themselves raw sometimes.
That frantic grooming.
Yeah, it's what we call a displacement behavior. Their body's just trying desperately to cope with overwhelming internal stress.
Okay, wow. That paints a picture. It's a full body terror response. And the triggers,
Yeah,
the sources list more than just thunder and fireworks, right? It's surprisingly common things.
they really do. The big ones, yes, fireworks, thunderstorms. And remember, with storms, it's not just the boom. It could be the rain, the wind, lightning flashes,
Mm-hmm.
maybe even things we don't notice, like static electricity changes or barometric pressure shifts.
Right, those subtle cues.
But also, yeah, gunshots, loud bangs from construction nearby, even household appliances, your vacuum cleaner, blender, hairdryer,
The sounds of everyday life for us.
can be terrifying for them. Sirens, alarms, doorbells, even something like a baby crying unexpectedly. You can see how pets might encounter these triggers pretty often.
And the sources mention this often isn't isolated. It can lead to other anxieties.
That's right, comorbidity.
Huh.
Noise phobia can exist alongside or maybe even lead to other issues like separation anxiety or just a general state of anxiety. It's often connected.
So understanding all this, the biology, the range of triggers, it really shifts your perspective, doesn't it? It's not bad behavior.
Not at all. It's a genuine anxiety disorder. And recognizing that helps you see your pet needs support, not correction. It validates what you're seeing.
Okay, so we understand the what and the why. How does this panic actually look? Because the sources say cats can be much trickier to read than dogs.
They really can be masters of hiding it. The signs can range from, mild unease all the way to severe uncontrollable panic. With dogs, it's often, well, pretty obvious. Excessive vocalizing, that high-pitched whining, frantic barking, maybe howling, intense trembling or shaking is super common. You might see lots of panting, even drooling.
Or they become Velcro dogs.
Yeah, exactly. Suddenly needing to be right next to you, practically climbing on you. Or the complete opposite, desperate hiding. Under the bed, in a closet, trying to squeeze into the bathroom.
Pacing, too.
Oh yeah, restless
Oh.
pacing, can't settle down. And the destructive behavior. That can be really upsetting for owners.
I bet. Chewing furniture, digging at carpets.
Often it's actually a frantic attempt to escape the sound, escape the situation. Inappropriate elimination is another big one, urinating or defecating inside, even if they're perfectly house-trained otherwise.
Yeah.
It's a sign of extreme stress.
Try and break out of crates or rooms.
Yes, real escape attempts.
Mm.
Physically, you might see dilated pupils, that wide-eyed, whale eye look. And in really severe cases, sadly, they might injure themselves in their panic.
That's a really vivid picture for dogs. So what about cats? How does their deep fear show up when they're trying so hard to be subtle?
You nailed it. They often internalize. Hiding is probably the #1 sign. Under beds, way back in closets, seeking high ground, like the top of a cat tree or a shelf. Anywhere they feel concealed.
Less visible signs.
Right. They might just freeze or crouch really low to the ground, trying to disappear.
Mm.
Excessive vocalizing can happen too. Unusual meowing, maybe growling or hissing if they feel cornered.
Do they tremble like dogs?
Generally not as much. It's less common in cats.
Mm-hmm.
But like dogs, inappropriate elimination is definitely a sign of severe stress. You might also see over-grooming, that displacement behavior again.
Licking themselves excessively.
Yeah. Physically, look for dilated pupils, ears flattened back against their head, maybe paloerection, their fur standing on end along their back or tail. Aggression is rare, but possible if they feel trapped. And just changes in routine, not eating, less active around trigger times.
Okay, so knowing these specifics, even the subtle cat signs, it helps you see past quirky behavior and identify the fear underneath.
Absolutely. It gives you the insight to say, okay, this is what's really going on, which is the essential first step towards actually helping them.
So let's say you see these signs, you suspect a noise phobia. How do you actually get it diagnosed properly?
Well, the sources are clear. It mostly comes down to the history you provide, what you observe, plus a good physical exam by the vet to rule out other things.
What kind of history details are important?
You need to be really specific. Which noises exactly trigger the fear? What did your pet do? Describe the reaction in detail: hiding, pacing, vocalizing, trying to escape. And how bad is it? Mild worry, obvious distress, or total panic.
And thinking about when it started, if it's gotten worse.
Yes, onset and progression. That's vital. Phobias usually worsen if left untreated, so knowing the trajectory is important. How often are they exposed to the trigger? And crucially, how do you react?
And my reaction matters.
Big time. Sometimes, overcomforting can unintentionally reinforce the fear. And punishment, as we keep saying, is always counterproductive. Also mention any other anxious behaviors you see.
Like separation anxiety.
Exactly. Then the vet does a physical exam. This is key to rule out medical issues that could cause similar signs or make them more sensitive, things like chronic pain, hearing loss, which can make sudden sounds startling, dental problems, ear infections.
So it's not just assuming it's behavioral. Got it.
Right. Need to check the physical side, too. Your vet might use questionnaires or even ask you to take videos of your pet during an event. For really tricky cases, the sources strongly recommend getting help from a specialist, a certified trainer who focuses on fear, or ideally, a board-certified veterinary behaviorist.
So this whole process, the history, the exam, maybe video, it builds a really specific picture.
That's the goal. A detailed picture of your pet's specific fear, which is what allows for the right treatment plan.
Which brings us to treatment. The sources hammer home this idea of a multimodal approach. What does that actually mean we need to do?
It means there's usually no single magic fix. You almost always need a combination of things working together. Usually that involves managing their environment, using behavior modification techniques, and often, especially for moderate to severe phobias, bringing medication in the mix.
Okay, let's break those down. First pillar, environmental management. Sounds like the immediate practical stuff.
It is. It's about making the scary event less intense right now and giving your pet a safe place to cope. The absolute cornerstone is creating a safe space, a sanctuary.
Like a den.
Sort of, yeah. A spot your pet already chooses to go to feel secure. Could be their crate if they love it, a quiet room, a closet, maybe the basement. The key is they like it and can get there easily. Don't force them.
Make it cozy.
Definitely. Favorite bed, blankets, maybe a long-lasting chew, or a food puzzle. For cats, remember they often like vertical space, so a high shelf in that room, or an accessible cat tree.
And dealing with the noise itself.
Right. Muffle it. Close windows, doors, pull heavy curtains. Mask it too. Play some calming music. Turn on a white noise machine or a fan. Even the TV or radio at a normal volume can help drown out the scary sounds.
Darkening the room for storms or fireworks.
Good idea. Helps with the flashes. Then there are calming aids. Pheromones like Adaptil for dogs or Philly Way for cats come in diffusers or strays. Compression wraps like a thunder shirt. Some pets find them comforting, but you must try it out first when things are calm.
See if it helps or makes it worse.
Exactly. Yeah, earmuffs are an option for some dogs. Calming beds, weighted blankets, lots of tools to try. But a really key safety point from the sources: if your pet panics violently in confinement, like a crate, Don't lock them in if they might hurt themselves trying to get out.
Safety first. Got it. Okay, next pillar. Behavior modification. This sounds like the longer-term strategy.
It is. This is where you're working to actually change their emotional response to the sound over time. It requires patience and consistency. The main technique here is desensitization and counterconditioning, DCC for short.
Sounds technical, but the basic idea is gradual exposure plus good stuff.
You've got it. You expose the pet to the trigger sound, usually a recording, and this is critical at a very, very low volume. So low they don't react fearfully at all, not even a flicker of worry.
Below their threshold.
Way below. And while that super quiet sound is playing, you pair it with something amazing. High-value treats, a super special toy, calm praise, whatever your pet loves most.
So you're trying to build a new association. Faint, scary sound means awesome things happen.
Exactly. You're counter-conditioning the fear. And only when they are consistently relaxed and happy at that super low volume do you very, very slowly increase the volume. Just a tiny bit.
Yeah.
If you see any sign of stress, ears back, lip lick, turning away, you stop immediately or go back down in volume.
Stay under that threshold.
Always. This needs practice in a controlled setting, short sessions, often daily. And this is really where professional guidance is invaluable.
Because doing it wrong could backfire.
Absolutely.
Yeah.
Pushing too fast or too loud can make the phobia much worse. A certified trainer or behaviorist can tailor the plan and guide you. The sources also stress your behavior. Stay calm yourself. Pets read our anxiety. Don't overcoddle, which can reinforce the fear. And again, never punish.
Reward calm. Ignore or manage the fear. Never punish.
That's the mantra. During a real event, maybe distraction with the game works if they're only mildly anxious. But often, if the fear is strong, they just won't be able to engage.
Okay, that makes sense. Now, the third pillar, medication. The sources suggest this is often pretty crucial, especially for unpredictable things like storms.
Yeah, it's often a necessary piece of the puzzle. It's rarely the only solution, but it can lower the panic enough so the environmental changes and behavior work actually have a chance to help. There are different types: acute meds for specific events and chronic daily meds.
Let's cover the acute ones first, the ones for events you know are coming.
Okay, for dogs, there's Sileo. It's an FDA-approved gel you put on their gums. You can give it before or even right when the noise starts. It helps reduce panic without heavy sedation, which is great. Trazodone is another common one, usually given an hour or two ahead.
And things like Xanax.
Right, benzodiazepines like alprazolam, Xanax, or clonazepam. They're fast-acting, good for panic, but they must be given before the fear kicks in. And they can cause sedation or sometimes paradoxically excitement or agitation in some dogs. A trial dose beforehand is usually wise.
Okay. And for cats, similar options.
Gabapentin is used a lot for situational anxiety in cats. Noise phobia is included. Give it maybe 2-3 hours before. It can make them sleepy or a bit wobbly, but often works really well. Benzodiazepines or trazodone might also be options for cats in these situations.
So the timing is really key with these as-needed meds before the panic sets in.
Absolutely critical. Now, for pets with very severe or frequent phobias, or if there's underlying generalized anxiety, daily medication might be the way to go. This aims to lower their overall anxiety level long term.
Like antidepressants for pets?
Kind of, yeah. SSRIs like fluoxetine, Prozac, or TCAs like clomipramine are common. These aren't instant fixes, though. They take weeks, maybe 4 to 8 weeks, to reach full effect and must be given every single day.
Are there side effects or things to watch out for?
Like any medication, yes. SSRIs might initially cause a bit of appetite loss or maybe seem slightly agitated. TCAs might cause sedation or GI upset. Your vet will discuss these. The most crucial thing is talking to your vet about your pet's entire health picture and any other meds they take. Some combinations or pre-existing conditions like heart issues or seizures can make certain drugs risky.
So definitely a vet conversation, and complex cases might need a specialist.
A veterinary behaviorist is really the expert for navigating complex medication choices and managing difficult cases.
Makes sense. The sources also briefly mention supplements and diets.
Yeah, they can play a role, maybe for milder anxiety or as an add-on to other treatments. Things like alpha-quesazepine, Zilkin, L-theanine, Angstane, calming probiotics, or special prescription diets like Royal Canin Calm or Purina Pro Plan Calming Care. They can be part of the multimodal plan.
Okay, so putting it all together, environment, behavior mod, medication, maybe supplements. It's clear there's no one size fits all. It's about finding the right mix for that specific pet.
Exactly. It's a tailored strategy and often involves some trial and adjustment, ideally with professional guidance.
Let's talk prognosis then. What's the realistic outlook? If a pet has this, are they stuck with it forever?
This is maybe one of the most important takeaways from the sources. If you do nothing, noise phobias almost always get worse. Each frightening event kind of digs the fear pathway deeper, makes them more sensitive.
That's sobering. But with treatment, what happens?
With that consistent multimodal approach we've been talking about, the prognosis is usually good, even excellent for many pets. You can see significant improvement, a real reduction in their fear, and a massive improvement in their quality of life.
So even if it's a really severe case, you can still manage it effectively. Maybe not a total cure, but much, much better.
Precisely. The goal becomes significantly reducing their suffering and distress, making those trigger events much more manageable for everyone. And the sources point out, early intervention gives the best chance. Helping puppies and kittens have positive experiences with different sounds during socialization is huge.
That offers real hope. Taking action can genuinely change things for them.
It absolutely can make a world of difference.
Okay, so let's distill this down. For a pet owner listening right now, feeling overwhelmed by their pet's fear, what are the absolute key takeaways?
First, know this is real. Your pet isn't being bad. They're genuinely suffering from an anxiety disorder. Validate that. Second, and we can't say this enough, never punish the fear. It will only make it worse.
Patience and consistency are crucial, right? This takes time.
Definitely. Behavior modification is a marathon, not a sprint. And finding the right medication might take adjustments. Stick with it.
Remember the multimodal approach in environment, behavior, meds? It's usually a combo deal.
Yes. And if you use meds, understand how and when to give them, especially getting those acute meds in before the event starts. Talk to your vet about side effects and safety.
Safety during events is paramount. Make sure they can't escape or get hurt.
And keep the goal in mind. Improving their quality of life, reducing their suffering. That's the win. Finally, don't go it alone. Get help from qualified trainers or veterinary behaviorists. It's a team effort.
Viewing it as a partnership, you, your pet, and your veterinary or behavior team seems really important.
It absolutely is. You're all working together.
Well, this deep dive has really covered the ground from understanding the frightening reality of noise phobia, recognizing the signs in dogs and cats through diagnosis, and crucially, exploring that multifaceted treatment approach. Hopefully this gives you, the listener, the tools and confidence to better help your pet through those scary times.
And just to leave you with something to think about, building on those subtle storm cues we mentioned, the static, the pressure changes, think about this. How does the possibility that our pets are reacting to things we literally cannot perceive challenge how we understand their fear?
It really makes you wonder, doesn't it? What else might be going on in their sensory world, influencing their anxiety that we're completely unaware of? A really interesting thought about just how complex their experience might be.